Greetings. Today I will be showing you how to put in an order with Puerto Rico Pathology for cytology, chlamydia, trichomonas, or gonorrhea, and HPV virus. I have entered Charm Tracker and I have opened an encounter for a dummy patient. This is a 38-year-old male. We are going to pretend like this is a female patient coming in for a pap smear. In order to put in a lab order in this encounter, I must first go to the recommendations bar. Once I've selected recommendations, I have several options. I can make prescriptions, I can recommend supplements, and I can order labs. In order to order labs, I select the Instant Add link. Several different labs are populated, including Puerto Rico Pathology. I'll select Puerto Rico Pathology and choose from the options that Puerto Rico Pathology gives us and what to order. I can choose the Thin Prep Pap with no HPV. I can select the Thin Prep Pap with HPV, or I could do the conventional Pap test. My personal preference is Thin Prep, and I'm going to do the Thin Prep with no HPV test. Now, anytime you send this to the lab, they're either going to bill the patient or they're going to bill their insurance or plan médico. In order to bill a plan médico, there needs to be a diagnosis associated. So here I'm going to map a diagnosis. So map again, and I have options to choose from previous encounters or from this patient's medical history. None of these previous diagnoses or findings in the medical history really make sense. So I'm going to order it anyway. There's no diagnosis associated with it yet. So I'm going to go back in here into diagnosis for this encounter, and I'm going to put Instant Add for diagnosis. I'm going to choose Z12.72 encounter for screening for malignant neoplasm of vagina. Z12.72. Selected. Okay, now if I return back to the recommendations bar and I go to that and I map the diagnosis for this order, now the encounter for screening for malignant neoplasm of vagina appears, and I can map that. I'm now ready to print the order. I select print, and it asks me if I want to include the insurance information. If Puerto Rico Pathology will be billing the individual's plan médico or insurance, yes, we will include the insurance information. This will not appear if the patient does not have the insurance information in Charm. You can ask the administrative assistant or front desk personnel to add the insurance to the patient details section. I'm going to include the insurance information because I would like Puerto Rico Pathology to bill this individual's plan médico, and I'll select print. A PDF appears, and it contains all the information necessary. From the patient details section, it pulls the address of the patient and phone number. The lab requires this in the event that the lab will send a bill to the patient or any necessary co-pays in any plan médicos, and in the event of an emergency where the lab needs to contact the patient directly. The provider and facility details includes the doctor, the ordering physician, and the NPI number of the ordering physician, as well as our address and phone number where to contact us. That's also essential. Additionally, here's the diagnosis code we included, Z12.72, encounter for screening neoplasm or malignancy of the vagina. And here's what we ordered. Thin prep pap test only, no HPV. Here we also have the insurance information appearing on this, so that the Puerto Rico Pathology can bill the Plan Médico. Here in the right hand corner you can see that this ordering physician has not enabled electronic signatures automatically. When anyone prints out a lab order for me, my signature appears automatically because I've enabled that. Select print, and you've made the order. I have now collected my pap smear in a thin prep. I've put the patient's name and the patient's ID on the specimen. I am now ready to send it to Puerto Rico Pathology. I will next need to fill out a requisition form, which I can find in this cabinet here, under the Puerto Rico Pathology folder. I pull out the requisition form, and together with the printout from CHARM that contains the patient information, ordering doctor's information, test to be ordered, and insurance information with the signature, I include on this order requisition form the patient name, ID number, and birth date. All of the other information is included on the page I will be attaching, and I will mark again thin prep, pap, and co-test. There's my signature and the date. I can place these two documents together and fold them nicely. I'll place them in a biohazard bag together with the specimen. I'll double check and make sure the name and ID is there. I can then come to the outgoing labs cabinet, find Puerto Rico Pathology, and I'll place it there. Then I'll pull down the log and I will record that we have waiting a specimen from dummy patient, record number, and there's one envase waiting to be picked up. At the end of the day, the administrative assistant will come to the outgoing labs and call the labs to inform them that they need to come and pick up. All specimens sent to Puerto Rico Pathology have no need to be refrigerated and can be kept for up to 3 days.